Hi guys, just in the office and I was doing a few email replies and someone sent me an email this morning saying, what do I do Dr. Amma when I go blank? When I do my exams, in this case it was PLAB 2, but it could be any exam, CSA, stage 3, whatever it might be. What do I do if I go blank in my exam? I'm really scared this might happen. What if I just go blank, can't think about anything else, questions don't go into my mind, I just freeze? What do I do? Now, I get asked this question a lot because it happens a lot. Now, it doesn't matter how much you know, it doesn't matter how many hours or months or years of preparation you've done for an exam, it doesn't matter how confident you are, it doesn't matter how many times you've been over the material, you are going to go blank at some stage. If you're doing an exam that is 2 hours long, 3 hours long, and it's testing your ability to consult or see patients or do role plays, you are going to go blank at some stage. You are a human being, you're not a machine. You're going to go through a point where you think, I don't know what to ask here, or you just freeze up. The first thing I would say is, look, accept this reality. When you accept something's going to happen, it doesn't hit you so hard when it does. If you go into an exam like this and think, I hope I don't go blank, I hope I don't go blank, I hope everything's okay, I hope it's all fine, I hope I don't freeze up. When it happens, and not if, remember, when it happens, you're going to get very disappointed. Oh, I knew it was going to happen. I can't believe I've gone blank. I really tried so hard this time. Accept it's going to happen. Accept that in a 2 or 3 hour exam, you're going to go blank at least 2 times, 3 times, maybe 4 times, okay? It's human nature. Accept it. The key is having a plan to deal with it, not hoping that it doesn't happen, and then when it does happen, not know what to do and just freak out. Have a plan. When I go blank, this is what I'm going to do. You need a trigger. You need something that your brain has been drilled to go back to every single time you go blank. And that's really important. Now, your trigger could be different for one person, different to another, but you've got to have something that is tried and tested, that you've worked on for several weeks, that every single time you go blank, you force yourself to think about that trigger. The first few times you'll remember, what's the trigger? I can't even think about that. But eventually it'll become so ingrained that when you go blank, that thought comes up. And all it takes for you to get going again is something to fill your brain. Often what happens is nothing fills our brain. We go completely blank, just a white space, and that's when we start to get stressed, make mistakes, jump into other parts of the consultation, and we leave lots of things behind. Have a trigger. For example, we talk about things like ice being a trigger. We talk about bubbles. For those of you guys who've been in our courses, we know we talk about bubbles a lot. Those are the triggers we talk about. Have those bubbles in your mind that just pop back when you go blank. Or it could be a particular question. It could be a statement that you make. It's just something that you know that when I go blank, this is what I will do. Because all your brain needs is a trigger. It needs a kickstart again. Once it's started on something again, more things will come back and things will start to flow. It's not having a trigger that gets people in trouble, because when you go blank and you don't have a trigger, the blankness goes worse, the stress levels build, and the pressure starts to build even more. So please, 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 please don't worry about going blank. We talk about this a lot on our day courses, our CSA courses, our stage 3 courses, and our PLAB 2 courses. So please book yourself for one of these if you're preparing for any of the exams coming up in the near future. We're going to teach you loads of these kind of little tips and tricks, not just the medicine, but how to deal with role play situations, because we make a lot of simple mistakes. Hope this helps. Hashtag Campus Will Pass. Hashtag I went with Arora. Do not fear going blank.